Hey people, it's Niles talking. Now I'm gonna be honest with you people. I've seen so many stories I do not know what to start with. But I saw this and I thought I have to do this because this had me my jaw hitting the floor. I was shocked. Family of Tuskegee syphilis study participant says they'll take COVID-19 vaccine but understand the distrust. This is from ABC News. Lily Tyson Head and her daughter Carmen Head Thornton have reason to be skeptical about the COVID-19 vaccine. After all, it was Head's father, Freddie Lee Tyson, who was unknowingly recruited into the now infamous syphilis study at Tuskegee, a sharecropper in Alabama, in 1932. Tyson was one of 623 black men recruited for the U.S. public health study at the Tuskegee Institute. The study was meant to record the natural progression of syphilis infection in black men. The researchers didn't tell those who signed on. Tyson, who had congenital syphilis, was only told he'd be receiving free health care. They did not tell them they had syphilis, and the only thing they told them was they had bad blood and they were treating the bad blood. Head told Nightline co-anchor Byron Pitts, but they were not. They were lying to the people about that. They were deceiving them. Please pay attention to what she just said. The experiment lasted 40 years. During that time, the American government made efforts to ensure the participants in the study never knew the intentions of the researchers. Even when they discovered penicillin was a reliable treatment for the infection, the participants were actively kept from receiving it. And I want you to understand something. There is no scientific reason to continue with this study at that point. You have a treatment, you can cure it and end it. This was just a study in torture and agony and just pure evil, really. There's no way to describe it. Thornton says she was only a child when her grandfather answered the call from the U.S. Center for Disease Control and Prevention to tell him what had really happened. Head said that her father was a gentle, kind, and wise man, but that call made him upset and disappointed. My father was a proud man, and he was honest, Head said. For someone to call him and tell him that he had been part of something for 40 years and never been told the truth and is not aware of that, then that would also bring some shame. And you also have to understand that syphilis was something that people were proud of having. Although Tyson died in 1988, Head and Thornton have been carrying on his legacy in hopes that something like the experiment never happens again. Oh, this is just comedy now. Yeah, I wonder if these people have a sense of irony. In memory of the men who unknowingly contributed their bodies to the study, they started the Voices for Our Father's Legacy Foundation, which aims to change the narrative surrounding the experiment and its participants and to connect their descendants across the generations. There is a desire and need for us, through our foundation, through my professional work, to want to move this story of the syphilis study to one that speaks towards being a victim, to being a victim, to being a victor, for moving from trauma to triumph, said Thornton, who works as the Director of Research Grants, Workforce and Development at the National Academy of Child and Adolescent Psychiatry. Both women say they understand why there is skepticism among black Americans to take the COVID-19 vaccine, although 27% of the public say they probably or definitely would not get vaccinated. 35% of black adults say the same, despite being disproportionately affected by the virus, according to a survey by the Kaiser Family Foundation. History has not been kind to African Americans, Thornton said. It has not been kind. People, please. History has not been kind. That's like saying, oh, people look back at the history in a bad way. No, the U.S. government has terrorized Diwani black Americans. Okay? It's not to say someone wrote a history book and got the bad idea. Please, let's stop with this nonsense. It has not been kind because of misperceptions that are connected to what happened in the study. I think it helps to grow mistrust, and that's one of the things that we're dealing with. Among the misperceptions surrounding the syphilis experiment, Head said many people believed the participants in the study were injected with the virus. They were not, she said, but rather given blood tests frequently. Okay, I want everyone to listen to me. Maybe they weren't infected with it, but they recruited these men knowing they had the disease. They started studying them and kept up this study for 40 years. 15 years into the study, they found a cure and made the whole study, from that point onwards, pointless from scientific terms. They kept their study going, letting them infect their wives and their children, and created incredible pain and suffering out of malice, cruelty, and a sadistic desire to inflict pain on Tijuanian black Americans. Let's never downplay this or play it off as something that was a misunderstanding. Don't ever do that. Thornton said that to rebuild this trust, there needs to be more people of color in the medical field. Her mother said that while there needs to be ethical people in the medical field. Her mother said that while there are more people of color in these positions now and that things have changed, things have gone better, they could still improve more. People, please. A few months ago, French doctors were talking about experimenting on black people because nobody cared what would happen to them. Am I living in some kind of alternate reality where people just see this and don't remember? God. I'm committed to spending my life in public health and in working in the way that I do because we need that representation, Thornton said. That's the reason why the syphilis study happened to begin with, because there wasn't that representation. What? Just babbling. There wasn't voices around the table, and so we really need to have that representation engaged in science, engaged in research, and engaged in respect for healthcare. You mean like that Kizzy Corbett whose tweets talked about how she disliked black people, thought they were ghetto, and that when she got married she wanted to find a white man? That one? That kind of healthcare worker? Okay. When asked if they take the COVID-19 vaccine themselves, they both said yes, without hesitation, Head said. As soon as the vaccine is available for me, I'm taking it. Well, she wins the Darwin Award. Citing other health disparities prevalent within communities of color, Head also implored people to take charge of their health. I want people of color to be able to look at situations, especially when it comes to protecting their health, and do their due diligence in finding out the necessary information so they can make the right decisions and not be afraid, she said. We have to step forward and not be afraid to make our lives better. These healthcare disparities are not created because white and black Americans are lazy or they don't care about their health. They live often in food deserts where there is not access to groceries or fresh fruit and vegetables, or it's just too expensive. When they go to doctors, many times they will not treat them or take them seriously. Black women often die in much higher numbers during childbirth than white women because often doctors do not take them seriously. They believe that black people do not experience pain, or if they ask for painkillers or medication, they're trying to pull a scam to get medicine or drugs to sell on the street because of stereotypes. And this whole thing about it being a long time ago, that is not true. Pfizer tested polio vaccines in or drugs in Nigeria, and this was 1996. During the 80s, 70s, and 80s, South Africa's biological weapons department spread AIDS amongst the black population. The last person who died of Tuskegee was in 2009, 1 year after Obama won the election. This is not a long time ago. Let us not try this kind of crap. Anyway, I know I've gone on a bit, so I'm just going to stop it right here. Please comment, rate, share, and subscribe. If you'd like to support this channel, I'll leave my GoFundMe description. If you'd like to follow me on Instagram, I'll leave it there as well. And if you want to check out one of my t-shirts, I'll leave that as well. I'm going to leave this article so you can check this out for yourself. Peace.